Whether you're just starting to explore or you're already scheduled for a lip lift, knowing the potential complications is very important. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon in Austin, and I do a lot of lip lifts. And in this video, you'll learn all about what to expect after surgery. Now, first, let's explore what exactly is a lip lift. A lip lift is a procedure where I make an incision just underneath the nose here to shorten the distance between the nose and the vermilion border, or the border of the red and the white lip here. I call it a facelift for the mouth, and I love the procedure. It's my favorite procedure, but there are some potential complications. Things that are not necessarily common but are inherent to any surgical procedures are things like infection, bleeding, as well as scarring. These are all very rare in a lip lift, but scarring is the one that most people are the most afraid of. And that's because, for good reason, it's in the middle part of your face. It can be very visible if you do have an unsightly scar. And that's the main focus on what a lot of our follow-up visits will be for after your procedure. I know numerous surgeons that do this procedure, and we all are looking for tips and tricks to minimize scarring. I do see you for about a year after the procedure to make sure that you're going on the right track and healing just fine, because there are certain procedures like microneedling or laser treatments that we can do early on that can help kind of bring you back to the right track if it's starting to thicken, or if the texture isn't quite the same as the surrounding skin. Things like bleeding and infection, they're very rare, but I do put you on antibiotics after the procedure. The lip lift incision is very close to the nostrils, and so I want to make sure that I'm minimizing any bacterial colonization. Some people are actually colonized with a resistant bacteria called MRSA, or methicillin-resistant Staph aureus. That can be just inside the nostrils, especially in healthcare workers, but really it's common in the general public now. So I have you on, like I said, an antibiotic, and then puricin spray or a hypochlorous acid spray that can reduce the bacterial colonization in the area and keep inflammation to a minimum. The next potential complication we want to avoid after a lip lift is asymmetry. And that can be for a number of reasons. One is if you have lip filler in your lips, we want to dissolve all of that beforehand, because a lot of times lip filler is placed to correct asymmetries. And so imagine if you were to do a lip lift without removing the lip filler. We take our measurements at the time of the procedure for things to be even. However, if you have lip filler that's lifting one side of your lip, it could make the measurements a little off. And so as those fillers dissolve, then one side of your lip may be a little bit longer than the other. So before surgery, I have everyone dissolve their lip filler, and afterwards we can fill them back up just fine if you need it. Some people don't need it after surgery, so it's just very important to make sure both sides of the lip are the same height. Now, for some people, they have different tone to different sides of their lip, and this can be to varying degrees. Some people, it's very subtle, and they may not have noticed it before surgery, but then after surgery, they're looking at their mouth a lot more in the mirror. And so it starts to come out, and then we look at their photos and we realize that when they smiled before surgery, that was the same. And if I catch it before surgery, I'll point it out, but sometimes it'll be so subtle that you won't really necessarily see it unless you're really looking for it. Some people have so much tone on one side of their face that sometimes neuromodulators like Jeuveau or Botox may be needed just to relax one side of the face so that it's more symmetric. Remember that no one is perfectly symmetric, so if you were to mirror image one side of your face over the other, no one's going to be completely symmetric. So I encourage you not to be too OCD about that. I know we're all a little OCD, but little asymmetries are normal. The next potential complication after a lip lift is overcorrection or undercorrection, maybe even the inability to close the mouth after surgery. There are different techniques for a lip lift. I do not incorporate muscle in my closure. That can cause a little bit more limitations in mouth movement. I've even had some patients come to me for revisions after having surgery with other doctors who almost had the appearance of like their lip had been a cleft lip at some point because they couldn't whistle, they couldn't move their mouth normally. And this is after a prolonged period of time of healing. So it didn't really get better until I went in and cut the sutures that were tacking up the muscle to the base of their nose. So it's important to not incorporate muscle in the closure. I place stitches just on top of the muscle so that it takes off tension but doesn't affect mouth movement. Now it's normal to have some weakness just from swelling. So swelling after a lip lift causes the orbicularis oris muscle, the muscle around the mouth, to be not contracting quite as much after surgery. But once swelling goes down, that goes back to normal. Now, as far as not being able to close the mouth after surgery, one, that can be prevented with not being overly aggressive with how much skin is removed. But two, identifying some patients that aren't the best candidates for a lip lift. So I look for things like the length of the middle part of the face, or how much the chin is projecting. Now, if the chin is a little bit weak, at the same time as a lip lift, we could do a chin augmentation, like with an implant or with a sliding genioplasty. That can help put less tension on the mentalis muscle and bring the lower lip up a little bit so that there's less strain on the mouth during healing and even afterwards, so that you'd be able to close your mouth no problem. Others may actually need something called orthognathic surgery. That means that you can shorten the middle part of the face and even correct for malocclusion, meaning the teeth aren't coming together normally. That's a very specialized surgery that I don't do, but I'd refer you to an orthognathic surgeon if that is needed prior to doing a lip lift. And now some people with a long middle part of their face naturally have a long upper lip, so I get those patients coming in to see me all the time wanting a lip lift, but unfortunately, if I were to do a lip lift in those patients, they would not be able to close their mouth. And of course, I really emphasize natural results, and I would rather you maintain function of your mouth as well as a good aesthetic. There are some other options that we can do, like fillers that can camouflage it until you have other surgery, but it's just not a good idea if you need orthognathic surgery first. Another potential complication after a lip lift is prolonged swelling. And again, this goes back to filler that can be in the area after surgery. I usually only see prolonged swelling if you have hyaluronic acid filler in the area. Hyaluronic acid attracts water, and so if you have any part of filler in that area, the natural swelling that comes with a lip lift will be attracted to that hyaluronic acid filler, and so it will eventually go down. Usually by the 1 month mark, you can't really tell anymore, but normally at the 1 week mark, most of that swelling's gone down. But if you have filler in your mouth or the cheeks or anywhere in that vicinity, you'll have a lot more swelling for approximately a month until that goes down. You can do things like icing, keeping your head elevated to help with that, but in general, you'll feel a little puffy for that whole period of time. The last potential complication after a lip lift is with allergic reactions. And again, this can be with any surgical procedure if you're putting ointments, topical treatments over the incision. So there are a couple ways you can have allergic reactions after a lip lift. One being the sutures that are underneath the skin. I use a suture called a PDS suture, which stays in about 3 months before your body resorbs it. It's very rare, but some people can have some allergic reactions to that dissolving material, which can happen with any type of dissolving suture. I usually see that it eventually goes away, of course, because the suture does dissolve away. I'd have you on some antibiotics and steroids for a short time to minimize any inflammation in the area. It's pretty rare, but it does happen occasionally. You can also have allergic reactions to any topical treatments you put on. I don't see it too often using puricin sprays or gels, but it can happen if you have allergies to chlorine. And so I'd like to know that ahead of time, and that way we wouldn't give you the puricin spray and we'd stick to things like Vaseline that have no additives in it. Even using Aquaphor, which has lanolin, can cause some sensitivities. The one no I say after any procedure is not to use Neosporin. Neosporin has the highest likelihood of irritation to the incision and can prolong redness and itching and can even lead to an infection if not discontinued. I hope this video was really helpful for you. Please don't forget to hit the like button and subscribe to my channel for more future videos.